When urine becomes acidic, uric acid stones may form in the kidneys. Kidney stones cause symptoms such as pain in the back or side, burning during urination, blood in the urine and nausea. Lab tests on your urine can determine the acidity level and screen for risk factors that may cause the kidney stones. Risk factors that may increase the acidity of urine include starvation, diarrhea, and uncontrolled diabetes. Making changes to your diet and lifestyle may help reduce the acidity of your urine and decrease the formation of kidney stones. Step 1. Drink water. Drinking plenty of water will help prevent kidney stones and will help decrease the acidity of your urine by diluting it. The amount of water necessary for your body depends on factors such as your activity level, according to the National Kidney and Urologic Diseases Information Clearinghouse. Step 2. Eat vegetables, citrus fruits and beans to help decrease the acidity in your urine. Diets high in animal proteins such as meat and dairy products may cause an increase in acidic urine. Step 3. Decrease the amount of purine-rich foods you eat. Foods containing high amounts of purines include organ meats, fish and eggs. Uric acid forms in the urine when the body breaks down purines. Step 4. Lose weight. Being overweight increases the risk of uric acid in the urine. Eat a healthy diet and exercise each day to help reduce weight, recommends Jill Pleuer, RD. Step 5. Avoid products such as cranberry juice or ascorbic acid because these items may increase urine acid levels. Step 6. Urinate when you first feel the urge. Holding urine in the bladder causes a decrease in water content in the urine and makes it more acidic. Step 7. Stop taking medications that cause a decrease in urine pH levels, which is acidic urine. Medications that may cause acidic urine include thiazide diuretics and ammonium chloride, according to Medline Plus. Avoid these foods when you have crystals in the urine. Chemicals in most people's urine effectively keep crystals from forming. When this process is inefficient, crystals composed of calcium plus oxalate or phosphate, or from uric acid, form. Some crystals pass through the urinary tract with ease, others cause tremendous pain. According to the National Digestive Diseases Information Clearinghouse, NDDIC, these stones, known as kidney stones, are one of the most painful urological conditions in existence. Avoiding certain foods may help to prevent stones from developing. Oxalate-rich foods. Oxalate is produced by the body and is present in a variety of foods. When oxalate builds up in the body, it can cause high levels of acid in the urine and trigger the development of calcium oxalate stones. According to the NDDIC, calcium oxalate stones are the most commonly diagnosed form of kidney stones. Foods high in oxalate include beets, chocolate, instant coffee, berries, concord grapes, okra, rhubarb, peanuts, spinach, Swiss chard, soybean crackers, wheat germ, spiced Indian tea, beer, and sweet potatoes. Purine-rich foods. Purines are substances that occur naturally in foods. Foods rich in purine content may promote crystals in the urine that lead to uric acid stones, according to the NDDIC. For this reason, people prone to uric acid stones prevent or reduce stone development by avoiding organ meat, anchovies, gravy, sardines, and sweetbreads, which are rich in purine content. Foods moderate in purines include asparagus, bacon, beef, carp, cauliflower, chicken, cod, crab, halibut, ham, kidney beans, lamb, lentils, lima beans, lobster, mushrooms, salmon, shellfish, snapper, spinach, trout, tuna, turkey, veal, and venison. According to the National Kidney Foundation, people who are prone to kidney stones may benefit from reduced animal-based protein intake, or consuming no more than 4 to 6 ounces of meat, poultry or fish per day. Salty foods. Sodium found in salt and salty foods can cause the body to expel excessive amounts of calcium into the urine, which increases the risk of crystals in the urine. According to the NDDIC, limiting sodium intake is more valuable than limiting calcium intake in preventing calcium oxalate kidney stones. Foods particularly high in sodium include fast food, French fries, canned soup, frozen entrees, bullion, gravy, potato chips, tortilla chips, pretzels, beef jerky, seasoned bread crumbs, processed deli meats, cheese-topped pizza, ready-to-serve tomato sauce, and pickles. Replacing table salt with natural herbs and low-sodium seasoning blends can also help to reduce sodium intake and prevent crystal formation. Alkaline your urine with these foods. Urine pH ranges from 4.6 to 8.0, according to Medline Plus. An acidic urine may increase your risk of developing uric acid kidney stones. A diet that increases your intake of foods that make the urine more alkaline, including citrus fruits, vegetables and dairy products, may help limit your risk of developing these stones. Acidity of the urine may also affect the development of oxalic and cystine stones, according to the dietitian website RD 411. Fruits. The alkalinity of your urine is affected by your intake of certain minerals. Calcium, sodium, potassium and magnesium are chemical cations that make the urine more alkaline. Fruits contain high amounts of these minerals, contributing to the alkalinity of the urine. Alkaline fruits include apples, apricots, bananas, berries, oranges, grapefruit, lemons, cantaloupe, cherries, figs, grapes, kiwi, mangoes, watermelon, honeydew melon, nectarines, pineapples, pear and tangerines. Vegetables. Vegetables contain high amounts of potassium and magnesium, and also help to make the urine more alkaline. The exceptions include corn and lentils, according to RD 411. Alkaline vegetables include asparagus, beets, broccoli, Brussels sprouts, cabbage, celery, chard, cauliflower, collard greens, cucumbers, eggplant, kale, lettuce, mustard greens, onions, parsnips, peppers, pumpkin, turnips, sprouts, sweet potatoes and watercress. In addition to contributing to the alkalinity of your urine, a diet high in fruits and vegetables decreases your risk of developing chronic diseases, such as diabetes, heart disease and some cancers, according to the U.S. Department of Agriculture. Nuts and seeds. Most animal protein foods increase the acidity of your urine. Nuts and seeds can act as an alternative protein food. Some nuts can help to make your urine more alkaline and reduce your risk of developing uric acid kidney stones. Alkaline nuts and seeds include almonds, chestnuts, flax seeds, pumpkin seeds and sunflower seeds. In addition to contributing to urine alkalinity, nuts and seeds also contain high amounts of heart-healthy monounsaturated and polyunsaturated fats. A handful of nuts a day decreases your risk of heart disease. Dairy and other foods. The calcium in dairy foods helps to make your urine more alkaline. Alkaline dairy foods include milk, cheese, yogurt, buttermilk and cream. To limit your intake of saturated fat, choose low-fat and non-fat dairy foods. The fat content does not affect alkalinity. Molasses can also be used to help make your urine more alkaline. Stevia, a natural low-calorie sweetener, is another. Prevent kidney stones by adding this simple fruit to your daily diet. Kidney stones are the most prevalent urinary tract disorder in the United States, affecting over 1 million Americans every year, according to the National Kidney and Urologic Diseases Information Clearinghouse. This painful condition occurs when a mass forms in the kidneys due to highly concentrated matter in the urine. Stones slowly develop over months or years and are composed of various minerals, such as calcium, uric acid and oxalate. The University of Maryland Medical Center advises against treating kidney stones with alternative therapies, but the center does recommend following nutritional guidelines to prevent them from recurring. Causes and symptoms. Kidney stones are mineral crystallizations caused by an imbalance of nutrients in your urine. They are often the result of absorbing too much calcium, consuming excess calcium or other minerals, intestinal problems, urinary tract infection or genetics. The most prevalent type of stone is calcium oxalate formed from excess calcium and oxalate in your urine. Calcium phosphate stones result from low-acid urine, while uric acid stones occur from urine that's too acidic. Symptoms of kidney stones include severe and sudden pain in your backside, abdominal pain and pain in the genital area, nausea and vomiting, fever and chills. Potassium in bananas. If you excrete a lot of calcium in your urine, you are at risk for calcium-containing kidney stones, according to the Linus Pauling Institute. A lack of potassium in your diet increases how much calcium you excrete, putting you at risk for kidney stones. By boosting potassium in your diet, you can minimize how much calcium you expel. The adequate intake of potassium is partly based on the amount needed to reduce your risk of kidney stones and is set at 4,700 mg for adults. One medium banana contains 422 mg of potassium. Magnesium in bananas. A diet high in calcium and low in magnesium can cause calcium to contribute to kidney stone formation. Magnesium prevents calcium from combining with oxalate, reducing the formation of crystals that result in the most common type of kidney stone. The University of Maryland Medical Center advises eating bananas to prevent kidney stones because they contain magnesium and very little calcium. One medium banana provides you with 32 mg of magnesium, or about 10% the recommended dietary allowance for women and about 8% for men. Other remedies. Aside from bananas, other dietary changes can reduce your risk for kidney stones. Eat antioxidant-rich fruits and vegetables and foods high in fiber. Limit refined grains and reduce your intake of animal proteins, which cause you to excrete higher amounts of calcium and uric acid in your urine. If you've developed calcium oxalate stones in the past, decrease your intake of foods high in oxalate, including spinach, rhubarb, beets, nuts, coffee, black tea, strawberries and beans. Reduce sodium and sugar intake, which is associated with stone formation. Exercise regularly and drink plenty of fluids.